We should not be arguing about masks. We should be talking about the elephant in the room, which is nations with obesity, with diabetes, with lung disease, but really you could think about it as metabolic disease induced by unhealthy metabolism. Those are the people dying. Those are the people suffering. And there's no pill for that. Mm-hmm. The answer is lifestyle change. And for a lot of those people that are way far down the line of chronic disease, there's no reversing it. And that's the tough pill we have to swallow, that this virus is exposing our weaknesses. If you have a vitamin D less than 20, your chance of getting a serious complication or death from COVID is huge.
Vitamin D deficiency? Less than 20?
Less than 20 nanograms per milliliter.
Okay.
But just in America, the way we measure it, and people will get their vitamin D tested at their doctor's office, and if your level is less than 20, you have a severe hormone deficiency. Rhonda Patrick recently went on Joe Rogan, and she's the first real person going on a platform as big as his to talk about this. Yeah. And like we talked about it a bit, vitamin D is a hormone. It's a steroid hormone.
Yeah.
It's not a vitamin. It's a misnomer. It's like mislabeled. It does not just affect your bone health, which is the way I was taught and most doctors think about. It affects your immune system. And now the research is coming out. It affects your gut health. And we all know, or are starting to learn, how important gut health is. It definitely affects your mood lability, how labile your mood is.
Yeah.
And that's just to name a few factors. On our Sapien platform, we'll be releasing a ton of information about this, just because this is a really powerful intervention that you can do. Which is supplement vitamin D and go out into the sun.
Go out into the sun.
You got it.
Yeah.
And why are our leaders not doubling, tripling, quadrupling down on those recommendations? Like, to me, that's where we're failing. We're failing on if over the last few months we were honest with ourselves and say we have an obesity epidemic of horrifying proportions.
Why do you think people are so scared to confront that? Because it really is a fact. I mean, if you've traveled around the world, you'll see it. You know, what do you think is the hesitation there for people?
It's hard to change course. Not to go too deep into the nutrition story, but we used to eat a healthy diet in the 1800s, like we did in the early 1900s.
Yeah,
and then we started messing with and developing this concept of Western medicine. There was a bunch of arguments about nutrition. Instead of anchoring ourselves in our ancestral ideas, it was, we need evidence. And there was a battle. There was a battle between this guy, Yudkin, and Keys, and Ansel Keys. Some of your listeners might know the story, and I can talk about it if you want. But basically, there was a battle of public opinion. What is causing everyone to have heart disease? Heart disease was killing people.
What
Eisenhower
time period of this? 50s?
Yeah. This was kind of rolling out over the 20s, 30s, 40s, 50s. This is when we were developing Western medicine. That's when we started doing evidence-based research, and we really got our hands on it. And so there was a theory proposed that fat caused heart disease, diet heart hypothesis. Okay, and that was a theory. It made enough sense, and this is probably what most people listening think. You eat fat, it makes you fat. When you're eating the fat, it ends up in your artery, because that's what we see, cholesterol and fat in the artery, and you get a heart attack. So simple enough. Stop eating fat, and you'll do great.
Yeah.
It's very simplistic, and the body and physiology is not that simple.
Right.
And we were wrong.
So that was a hypothesis pitched by, I assume,
a group
team
of this guy Ansel Keys, who was a botanist, not even a doctor, really promoted it aggressively. And he was really like vocal and very eloquent. And if you look back into the 1960s, there's iconic images on Time magazine of this guy with thick framed black glasses. That was Ansel Keys. He was like a public figure. People looked to him for guidance.
Jamie, can we pull up Ansel Keys, please? Jamie,
Jamie,
let's pull up a picture of Ansel Keys. Yeah, don't say anything though. Don't say anything. Oh, there he is.
There he is, with the thick frame glasses.
Yeah.
Yeah. So this guy really pushed this concept of the diet heart hypothesis. There were other researchers battling against him. Most famous, this guy Yudkin, I can never remember his name. He was a mild-mannered, quiet guy and was like, I think it's the sugar and flour, processed food. Meanwhile, we're making a lot of flour, we're making a lot of sugar, like we're growing a lot of this stuff.
Yeah.
And there's a lot of money to be made to continue that. And what happened was, instead of doing the research, they sort of made the recommendation. They're like, you know what? Low fat is good. Cholesterol is bad. Low cholesterol is the recommendation. We got to eat grains. Grains are an essential part of our diet. And so, to get to your question of, why are we not talking about it? It's been 60, 70 years, right? And all these doctors and scientists and leaders of the CDC and all the or I should say the American Diabetes Association, all these things, they all have been promoting something, and for them to say, "Uh-oh, we were wrong,"
right,
publicly, would be really bad.
Yeah,
and it would hit a lot of people's pocketbooks. So I think there's a lot of reasons why it's very hard to change, but there's subtle things that are happening. American food guidelines dropped the cholesterol limitations. So, they used to say,
I saw that. Yeah.
But why? But no one knows. No one knows. Do you know how profound that is? If you went to if there was news media talking about, we were wrong about cholesterol, everyone. Cholesterol is not bad for you. It turns out
it makes up your cells.
It's what makes like an animal, a mammal, and not a plant. It's the thing. Vitamin D is made off of cholesterol. Every cell in your body is made. Your brain fires on cholesterol. Cholesterol is the building blocks of life. Maybe we were wrong.
Yeah.